Airway clearance is an important part of CF therapy and management. As a physiotherapist, my role on the team is to educate patients about the different airway clearance options they have and to facilitate an airway clearance routine that best fits a patient's lifestyle. There are lots of different airway clearance options. We have different breathing exercises that patients can perform, including active cycle of breathing techniques, ACBT, and autogenic drainage, AD. These two breathing exercises are well supported by the literature in terms of their efficacy for clearing airways of secretions that CF patients have. The second option for airway clearance is manual chest physiotherapy techniques that include clapping and percussion, as well as Kolakowski techniques, which are a bit more on the gentler side in terms of soft tissue techniques and massage techniques that help facilitate the chest wall movement to clear the airways. There are also other chest clearance devices like the therapy vest and aerobica that are less supported by the literature. Some of our patients do use these devices, but often during hospital admissions, they don't bring them in with them. We also have manual percussors and different electroflow devices that help to mobilize the secretions using the basis of electrical percussion through a handheld device, and sound waves that help to loosen the secretions from the chest wall so that patients can cough them out of their airways. The last category of airway clearance devices are the PEP devices, or the positive expiratory pressure devices, and the oscillating PEP devices, which stands for oscillating positive expiratory pressure devices. There are three major kinds of PEP devices: the AstraPEP, the TheraPEP, and the PeriPEP. They all function on the basis of providing positive expiratory pressure as patients are breathing out through the different devices. The AstraPEP has a one-way air valve where the resistor at the one end can be changed using different nozzles that provide a greater resistance the smaller the nozzle is, or less resistance the bigger the nozzle is, as patients are breathing out through the device. The TheraPEP works on the same principle, with a visual cue for patients to see a ticker as they blow out through the device, as the ticker should remain between these two lines to ensure them that they are breathing out efficiently through the device. The resistance on the TheraPEP can be adjusted on the dial that is present at the beginning of the device. The PeriPEP is the most cost-efficient device of the PEP devices, and it functions on the same principle. Here, the resistance is changed by using the little dial that allows the hole at the top of the device to become progressively smaller the more resistance that is needed by the patient. Oftentimes, when patients are using the PeriPEP and the TheraPEP, we recommend that they use a nose pin or a nose clip to occlude their nose, as when patients breathe out in the expiration phase, they will lose the positive pressure that they should be collecting for benefit for the airway clearance. There are three major oscillating PEP devices. These devices have the same positive expiratory pressure mechanism as the PEP devices. There is just an added component of a little bit of oscillation, which patients feel at the level of the cilia in their airways. First, we have the flutter device. This device operates on the principle of the steel ball bouncing up and down in this cone device as patients are breathing out through the device. The bouncing of the ball enables patients to feel a little bit of a vibration, as well as the positive expiratory pressure, so that they can facilitate the movement of the secretions in their airways. The acapella choice is the second of the oscillating PEP devices. Inside this device, there is a reed that bounces up and down as patients are breathing out through the device. So you have the positive pressure as well as the vibration through the reed that patients have in order to clear their airways. The benefit of the acapella choice is that there is a dial at the back where they can increase the resistance or decrease the resistance with which they are getting the positive pressure. Lastly, we have the acapella device. We don't recommend this device to our patients, as this is a device mostly used in pediatric populations.